Developing now in KOMO News at 4 o'clock, new data is giving new hope in the fight against coronavirus. This latest model from the University of Washington's Institute for Health Metrics and Evaluation predicts significantly fewer deaths in the United States than previously forecast, going from initial projections of 1 to 200,000 deaths to roughly 60,000. Researchers say that substantial decrease will only happen, though, if we continue with strict social distancing. Johns Hopkins University have been tracking coronavirus cases nationwide. More than 14,000 people have died in the United States. More than 23,000 have recovered from the virus. And in our state, 429 people have died of COVID-19. And the latest update from the state health department shows more than 9,000 people have tested positive so far. A live look over CenturyLink Field Event Center, where we have just learned the field hospital set up there is moving. Today, Governor Inslee announced it's no longer needed, at least in our state. KOMO's Patrick Quinn joins us with those details. That's some good news, Patrick.
It is good news. However, it came as somewhat of a shock even to Army personnel who I'm told they don't know where they're going to be going, when they're supposed to move. They haven't actually started packing up inside yet. So while the announcement came from the governor, Army officials, they haven't made it official to at least personnel on scene. However, this is what we're learning right now. This is a look inside as the field hospital was being built at the exhibition center. It took more than a week for 2 units from JBLM and 1 unit from Fort Carson, Colorado to set up the 250-bed makeshift hospital that was set to treat non-COVID patients. The decision by the governor comes after President Trump this weekend pulled a 300-bed medical station from Yakima. And on Sunday, the governor sent 400 of Washington's ventilators back to the national stockpile for New York and other states in desperate need. Today, the governor, in a statement on the CenturyLink Field Hospital move, said, quote, "Don't let this decision give you the impression that we are out of the woods. We have to keep our guard up and continue to stay home unless conducting essential activities to keep everyone healthy." Today we saw trucks driving in and out. Personnel on the ground I spoke with said they didn't know anything about a move. Again, the governor said this field hospital, it just needed to be moved. Where it's headed next, we're not sure. I reached out to FEMA. They're not sure. The Army isn't sure at this point, but at least, yes, some good news that it's no longer a need for Washingtonians. Mary?
I have a couple of questions for you. So first, will the state be prepared for a potential spike in COVID cases? Oh, can you hear me now, Patrick? Can you hear me now?
I can hear you now.
Okay, so no problem. Yes. So I was going to say I have 2 questions for you. So the first is, now that that field hospital is leaving, will the state be prepared for a potential spike if we see that? And also, do you know anything about the other field hospital up in Shoreline?
We've reached out about the other field hospitals in the state, including Shoreline, have not heard back yet. So that's that first question, or second question you asked. To the first question, yes, this is something that the governor is almost bracing for. Now that we're seeing ventilators leave the state, field hospitals leave the state, they are worried that people will think, all right, we're all good, everything's in the clear, we can leave our homes now. And they're already accounting for that. They have 1,000 beds that they've already bought. They also bought 900 ventilators just in case that we see this reaction. Reactionary spike. However, of course, the message is still that I'm hearing from the governor, from the mayor's office, from the county executive's office is stay indoors. This is a great sign that this field hospital is leaving. It's going to somewhere that it can be better used. But again, this doesn't mean that we're out of the woods yet. The governor's words specifically. Mary?
All right, Patrick Quinn, live in Seattle. Thank you very much. A new drive-up test site opened in Bremerton today. Air 4 flew over that site. This is over the National Guard Armory. Now, right now, this site is only for healthcare workers and first responders, and they do plan on expanding testing to high-risk patients with COVID-19 symptoms later this week. But you can't just show up. You must have an appointment to be tested here. You can go online to register or call the Kitsap Public Health District. Emergency teams and healthcare workers will now get to skip the long lines outside Costco stores. Costco says frontline workers with official job identification will get priority access. The Kirkland wholesaler announced earlier this month it will only let 2 people per membership card inside to increase social distancing.
And following Seattle Mayor Jenny Durkan's announcement yesterday to temporarily suspend public works construction to conduct health and safety training for workers, Port of Seattle just put this out a few minutes ago saying they will temporarily suspend 20 current construction projects from April 9th through April 13th. And this is basically complete reviews, they say, and updates of contractors' job site safety plans. Of course, they say this is also an action necessary to protect workers from slowing the spread of COVID-19. The social distancing, physical distancing, a huge deal right now, as well as also people wearing those face coverings, because a lot of people can be asymptomatic out there spreading COVID-19 without even knowing it.
The state wants to know how 3 inmates and 3 staff members at the prison in Monroe got sick from coronavirus. The infected inmates are in the same minimum security unit where another inmate tested positive on Sunday. All 3 are now in isolation. About 100 other inmates and 20 staffers are also quarantined for the next 2 weeks. Transit workers are showing up to work during the pandemic. They are essential workers possibly exposed to the virus every day. That's just what happened to one King County Metro bus driver. KEMO's Kara Kosinich is live in Seattle with more on that. Kara?
And driver Chris Watt is back on the road today, Mary. He boarded his bus about 30 minutes ago, and he tells me he knows how lucky he is. The 59-year-old started developing COVID symptoms on March 17th. Body aches, fever, cough, no energy, and loss of taste. He was able to get into the doctor a week later and was tested the same day. 2 days later, he learned he was COVID positive. Watt says he believes he picked up the virus on one of his Kirkland routes in early to mid-March. He says the illness was like nothing he's ever experienced, but he said not as bad as what many folks have endured.
I feel very lucky that it didn't develop the way it does in a lot of people. Felt like I dodged a bullet there.
And Chris was out of work almost 3 weeks, but today he says he feels great, although a little winded when he's out walking. Mary, we're going to have much more on these transit workers and what they're facing in this COVID crisis coming up at 6. Mary, back to you.
Kara, is King County Metro seeing a lot of sick drivers?
Well, what we know is this, Mary. Metro is not confirming any cases to us, but the transit union tells us that Metro has confirmed 3 cases to them, 1 driver and 2 mechanics. Now, in Snohomish County, it's a different story. Community Transit has had 12 confirmed cases. They tell me that's of last night. They still have 5 cases pending. These are frontline workers also fighting for their life. We're going to have much more at 6 tonight. Mary.
We'll see you then, Kara. Thank you.